originally in undergrad studied history, specifically African history. And at the time I was working for the school newspaper and really kind of got into journalism. And that was kind of my thing in college and thought I was going to end up a journalist. Um, and I really over time realized that the majority of the opportunities when I finished school in 2004 were really shifting to the online space at that time. And it was less about being a reporter out, in the field getting interviews and more sitting in front of a computer and reworking headlines and kind of regurgitating the same stories. So I did that for a short period of time after college and realized it just was not like fulfilling me on a bigger level. And so I like to describe my post-college time as like, I just kind of bounced around and tried to explore what felt like the right fit for me.
Mm,
So I worked for a few months doing some freelance journalism. And then I worked for a law firm for a year and change that actually represented journalists and other media entities. So I got to really get into the weeds in First Amendment law, which intellectually I found very intriguing.
yeah.
But on a day-to-day basis, I was like, I don't want to be a lawyer. So
Yeah.
I learned that in that job. And while I was in that job, I kind of always had this feeling of like, I just want to learn. I love learning. And so I ended up taking a class in the like evening classes at the college where I went. And the class was called Clinical Research in Emergency Medicine. And I signed up for it because I thought, that won't be boring. I know nothing about this. I'll learn something. It'll be kind of interesting. And it was a class where you really learned about what is clinical research, what does that mean, in a didactic format. So sitting in a classroom, learning that way. And then you actually got assigned to a clinical setting to
Mm,
basically perform clinical research. So I got assigned to the emergency department. My job was to wear a cute little gray coat and walk around and enroll patients into, they had at times between like 10 and 20 studies running in their emergency department.
wow.
So I went around and looked at all the patient charts and tried to identify patients that qualified for studies and then go in and counsel them and say, hey, are you interested in participating in this study? So during that, like basically I was paying to work in the emergency department
Yeah.
via
I
a
know that.
class.
Yeah.
I was like, shoot, I really like this. And what I liked about it was that it involved, you know, being smart and getting to use your brain and doing a lot of reasoning, but it was also very interactive. It was
Mm,
all about sitting down with a patient, hearing their story, getting information from them, and then also going to colleagues, whether it's other residents, attending physicians, nurses, collaborating, working together in a team-based environment to come up with a solution and a plan. And I was like, this is exactly what I've been missing sitting behind a computer as a journalist, sitting behind a computer as basically a paralegal at a law firm, was that like real human connection. And for me, the light kind of went on that in order to provide medical care, you have to get to know your patient. And so
mm,
kind of embedded in the role of being a doc is talking and hearing stories. And so in some ways I was like, this is almost what I thought journalism was going to be, is like
right.
hearing stories, eliciting stories, and then doing something with those stories. And I actually felt like I had more to do in a medical setting than I ever was able to really accomplish by just telling the story, in writing. So that's what kind of piqued my interest. That being said, I was like 3 years out of college at that point. I had studied nothing related to science at all as an undergrad, nothing. And so I was like, uh-oh, I do not want to call and tell my family and friends that I think I want to go into medicine because they're going to think I'm a lunatic. So
Right.
I ended up staying on and working in the emergency department at night and gaining a lot of experience over a year or so, and really realizing that it seemed like the right decision for me. So I gained some more experience. Um, and then I also just did a lot of reaching out to folks in medicine and really trying to understand what would be the best pathway for me in medicine too. At that point, I was, getting a little bit older. So I thought maybe I shouldn't become a doctor. Maybe I should do nurse practitioner or PA route. So I really kind of weighed all of those options, and ultimately decided to become a doc because it, from my perspective at that time, which I do feel like this has come to fruition, it just leaves lots of doors open. So it allows you to both gain skills in clinical care and be a full-time clinician seeing patients if you want to. but I think the MD also affords some flexibility to move into other spaces with respect. So whether that's advocacy, or, advocacy for social justice, or, I just felt like I could kind of use my degree in different ways. Research is another example. I felt like I could really flex into those spaces if I wanted to. So I ended up doing a lot of research, and there are these programs out there for people who should have taken all the prereqs for med school and college, but didn't because they were
Hmm.
studying something else. And they're called post-baccalaureate pre-medical programs. And there happened to be a really good one outside of Philadelphia, which is where I was living at the time. So I went to Bryn Mawr for 1 year and did all 8 prereqs for medical school in a
Wow.
12-month period. It was an intense 12 months,
Sounds
but
very intense.
yeah, definitely worth it to me to just kind of get it all done
Of course.
really quickly. And then I ended up directly linking to medical school at the University of Rochester, which is where I went to medical school.
Nice. And
Um,
that's where you're at
yeah,
right now, right?
yes, it is, ironically.
Well, it's great. I mean, I think it's interesting that you started off in like interviewing skills, because one thing that I hear with doctors or anybody in the medical field is just like paying attention to detail and getting all the information out, or getting everything from the patient. And the fact that you had that as like a subset of requirement or a subset of information for your degree, I think it puts you at a different, I mean, interview skills are huge.
Yes, yes. I do feel like it kind of was a leg up. I think too, I also have subsequently gone on to do some teaching in medical school. And I find, and you can probably identify with this too, but one of the biggest skills that you learn when you go into any healthcare profession is like basically that like confidence to walk into the room and introduce yourself and say, hey, I'm here to take care of you today. What's going on? And I
Mhm.
think the other thing that I came in with is like, I just kind of had that ability to go in and start to talk to people because that's something I had to do as a journalist. That awkward feeling of like, oh, I'm going to walk up to this person that I don't know at all and
Yeah.
just try to get into it with them. And so I think that came a little bit easier to me, um, and I think has made, is probably one of the reasons why I've ended up in places like primary care too, where really the crux of my job is understanding someone's life,
Mhm.
understanding their context, understanding how they live, what their family is like, and really getting to know that to understand what treatments might be effective for that person.
Yeah,
Um,
and it seems like anytime someone has like a midlife crisis, or at least from what I've heard, is like I feel like sometimes when people switch, they're always like, "Why? There's no human involved in this," and then they're always looking for something more human, or at least interacting with a human, or helping somebody else out. So maybe for somebody out there who's like struggling to figure out if they don't want to be an accountant anymore, maybe it's working with somebody or working with humans in general might be
yep,
your solution.
exactly, exactly. And look into post-bac pre-medical programs because they're
Yeah.
they're out there for if you're like, but I didn't take any of the classes. Don't worry, there are programs for us indecisive folks.